Data from the Royal College of Obstetricians and Gynaecologists suggests the number of outstanding appointments for conditions ranging from endometriosis to menopause care and fibroids has risen by almost 200% in the period since the pandemic. The college's president is calling for urgent change, warning that women are being let down. Well, we did ask to speak to the Women's Health Minister, Jenny Minto. She wasn't available this morning. The Labour MSP, Monica Lennon, is the convener of the Women's Health Committee at the Scottish Parliament. She's with us. Good morning to you, Ms Lennon.
Good morning, Laura.
I suppose at the very outset of this, we should explain that waiting list numbers don't necessarily represent patients, because patients can be on more than one list at a time.
That's right. We have to look at data carefully, but these figures speak very loudly. There's far too many women right across Scotland waiting far too long for medical care. We know it's an issue across the UK, but the reports today are a terrible read for women in Scotland. And despite the Scottish Government publishing a women's health plan, we're not seeing real progress being made. So something really has to change, because for the women that I represent in central Scotland, and indeed women across Scotland, their lives are in turmoil in many cases, and women are having to borrow money to go abroad for treatment. It's a scandal.
What are you hearing from the women who are speaking to you in your capacity as the convener of the Women's Health Committee?
Well, Brittany Gibson, who was on your programme earlier, is one of the women who addressed the Scottish Parliament last year in front of the Women's Health Minister. It's a different minister now, but the issues are clearly still as challenging. So women say that they feel they're not believed. They have to go to their GP multiple times just to be believed, and often symptoms are dismissed. Oh, it's just a bad period, take some paracetamol. But when people don't get that, early diagnosis, the condition gets worse. So if we're speaking about endometriosis, we know it's chronic. We know there's no cure for it. And the longer it's left untreated, it can spread, to vital organs. It can really have serious consequences. So right now, I'm supporting one constituent in Lanarkshire who spent about a decade trying to get the right care and support on the NHS and was just battered away. She had to go to Budapest to get treatment, and I'm now fighting for her to be reimbursed, because it's not fair. Why should women in Scotland have to suffer and then have to go and pay for private treatment that they should be getting here on the NHS?
Is there a sense that this is a speciality that's taken less seriously within the medical profession? Because obviously we know that waiting lists have increased since the pandemic. It's not just gynaecology, but for them to treble in that time, is it not being taken seriously enough?
I think you're absolutely correct. I think that's at the root of the problem. So that's an issue for the medical profession. We hear often from doctors themselves that issues around women's health and gynaecology, menstruation, these are just touched very lightly in their medical training, which is really quite shocking. I hear the term medical misogyny used a lot when we have discussions at the Women's Health Cross-Party group. So there's a responsibility for people in the medical profession too. But the Scottish Government...
So what can politicians do about that then, if there are, I don't know, fewer specialists in the field?
Mm-hmm. So I think it's a bit of a double-edged sword, because we have to value and recognise the good work of those who are doing these jobs day in, day out. And I know many working in the field of gynaecology who go above and beyond. So we have to support those colleagues who are already experiencing burnout and losing morale. We don't want them to leave the profession or to leave the NHS in Scotland. But we just need to see more people being funded to come into the profession, to choose that specialty, and to make sure it's high quality, because the training part of it is really, really important. For the politicians, today is another shocking day, but it shouldn't come as a surprise, because we know how bad it is. We know about the waiting times. We know that women are suffering. So we've had a debate in the Scottish Parliament recently, but one debate isn't enough. So this is a matter for the Scottish Government First Minister level and the Health Secretary to support the Women's Health Minister to make sure that it is given proper attention and priority. And
well,
one of the
on
things
that note, Monica Lennon, the Women's Health Minister Jenny Minto has said that the excessively long waits are not acceptable. She says that the Scottish Government has allocated over £450,000 to gynaecology from the £30 million targeted investment in planned care. I did some maths when I looked at that. That's 1.5% of that £30 million has been allocated to gynaecology.
I mean, I just don't think it's a serious response, and it is a real pity that the Scottish Government are not on today to answer to this report. I think women will feel let down. One of the commitments in the Women's Health Plan, which we welcomed when the Scottish Government brought this in, and all parties welcomed it, for 2021-2024 was to establish a Scottish Institute for Women's Health. Now, I think that's really important because that would have helped to drive forward policy and guidance, but also cover things like medical training and the fact that women's health is under-researched. So we really need to make progress on that.
Okay.
So that still needs to happen, and I hope the Scottish Government will take that work forward.
Monica Lennon, who's the convener of the Women's Health Committee at the Scottish Parliament, thank you very much indeed.